Good morning.
Good morning.
Welcome to Public Health Grand Rounds. Our speaker this morning is Ms. LaTonya Bynum. She's the Senior Analyst in the Office of Rural Health and Primary Care here at the Health Department. Her topic is the hidden gem at ADH. We've got lots of gems at ADH, but this one evidently is hidden. I want to tell you a little bit about Ms. Bynum. She graduated from University of Central Arkansas in 2004 with a Bachelor of Science in Health Education. Then she attended and completed a certificate program at Tulane School of Public Health in 2010 with emphasis on revolutionizing the data systems. Then she came to the University of Arkansas College of Public Health and earned her certificate in health disparities in Arkansas as her area of emphasis. And then she earned a master's in public health from UAMS in 2016. She had a title of her work, The Role of Depression in Effective Chronic Disease Management. She's published several papers. She's had a wealth of experience. She's worked here at the Health Department for 13 years. She just told me that she's retiring from the Health Department this month and taking a better opportunity in Conway. I also want to introduce her parents. They're here today, here on the front row. And I'd like for Mr. and Mrs. Bynum to stand and say hello to the audience. Okay, Ms. Bynum, welcome. We look forward to your presentation.
Thank you so much, Dr. Bates. Welcome, everyone. How's everyone feeling today? Good. You guys look great. Thank you so much. My parents are here, Mr. and Mrs. Stewart of Hot Springs, Arkansas. Please give them another round of applause. Thank you so much, Dr. Bates. You know, one thing about my work here at the Health Department, I just really enjoy talking about rural health and also my other work, hospital discharge. Today, I'd like to talk to you about a hidden gem, and like Dr. Bates said, there are many hidden gems, but this is one that holds near and dear to my heart. The hidden gem, which is the Office of Rural Health and Primary Care. How many of you know already a lot about the Office of Rural Health and Primary Care? By show of hands. So just a few. So when I'm out in the community doing presentations and talking, I'm always highlighting resources that come from the Rural Health Department, and everybody's always like, LaTonya, I did not know about this. Why didn't anyone tell me? And I'm like, I didn't know that you didn't know. So guess what? I'm on my platform to share this information with everyone. By the end of this presentation, I will have described the role of the Office of Rural Health and Primary Care. I will help you to identify several key rural health and primary care programs at the Health Department, and also discuss how this information can be used to improve public health in Arkansas. I have to start off with why I care, right? In my teenage years, you know, when my mom and dad were tired of me, they would send me off to go visit my grandmother, and then sometimes in summers we would go to Strong to visit our family there. And that's Conway County and Union County. While there, I love to walk the trails, visit elders, ride horses, and even I've ridden a cow. How many of you have ridden a cow? Right? So, and the favorite thing that I would do was go to town. And that meant that in a rural area, if you're going to go to town, that's a big deal because you get to see everybody who's anybody, right? And so how many of you are from a rural area in Arkansas? Okay. The inspiration for this presentation today is my the previous Office of Rural Health and Primary Care Director, Ms. Rebecca Brochus. You know, she would always come to me and say, you know, LaTonya, we really got to get the word out about what's going on in rural health. Our team, we're doing awesome work here. We got to get the information out there. And so she loved conducting site visits, traveling throughout the state, sharing her resources and her expertise. And she was a nurse by trade, and actually she came to us from in-home services. From her, I learned a lot about rural health, and unfortunately, in May of 2017, she passed away. And from that experience, I took on her role of sharing resources, even more so. And the wisdom that I learned from Ms. Rebecca Brochus was rural resources matter. Can we all say that together? Rural resources matter. The mission of the Office of Rural Health and Primary Care is to promote the development of community-based healthcare services and systems within Arkansas, and to assure that everyone receives well-managed quality health care services in the state. Some of the activities that we're involved in when you think of community-based needs assessments, we do a lot of work with hospitals with their needs assessments. Also, we recruit and retain primary care physicians, nurses, dentists who want to work in rural areas of Arkansas. Also, our office designates health professional shortage areas as well as medically underserved areas. We provide a lot of technical assistance for the development of primary care sites within Arkansas. Also, the team works together to provide access through federal, state, and local efforts. You know, when I came to rural health maybe 4 years ago, I was sitting in the office and I said, you know, I don't know if y'all know him, Randy Anderson. I went to his office and I said, Randy, where is the definition of rural health? And he said, you know, LaTonya, pick one. There are more than 10. And so as I was writing the proposals and needs assessments for rural health, I discovered that a lot of them had census data in it. And I said, well, that'll be my go-to definition. And so today, we'd like to highlight this particular geographical information system map, which highlights how many counties are rural. And so as you can see in this map, 62 out of the 75 counties of Arkansas are considered rural. And that means that less than 50,000 people live within that county. You know, back in 2015, under the direction of Ms. Tracy Bradford, when she was our director, we were tasked with creating two very informative documents. And one thing about these documents, we didn't want to make them hard to read. You know, you've seen those reports that are like 50 to 100 pages. Nobody reads them. They just sit on the shelf. We really wanted to make them useful for the communities. And so throughout the primary care needs assessment document, you'll see a lot of geographical information system maps with a lot of content so that our community stakeholders can simply copy and paste that information into the grant that they're writing. The primary care needs assessment is a supplement to our state rural health plan. How many of you have seen either of these documents by show of hands? Good. And so the primary care needs assessment and the state rural health plan is posted on the Healthy Arkansas website. I would love for you guys to go visit the website and take a look at those reports. And with the primary care needs assessment, we highlighted various risk factors. A lot of the information came from our vital record systems. These two reports would not have been possible without the work of the Health Statistics Branch. We thank them, the survey section, vital records again, as well as the manpower licensing survey. So just to highlight a couple of the programs that we have within the Office of Rural Health and Primary Care and some of their activities, we have the Primary Care Office Grant, which provides funding to states for improving the health care of underserved populations. Through this office, we're able to designate health professional shortage areas as well as medically underserved areas throughout the state office. Also, this office provides oversight for the National Health Service Corps grant. And so with this map, this basically shows you our primary care health professional shortage areas. And so when I'm talking about primary care, I'm specifically talking about doctors and nurses having a shortage in particular communities across Arkansas. And as you can see, the red area highlights several areas within our state that has very few health professionals working there. This map highlights the dental health professional shortage areas, and as you can see, the red shade shows, predominantly in the northern part of Arkansas, there's little to no dentists or dental providers working there. And this right here is the mental health professional shortage areas, and we're talking about behavioral health. And I know as a priority for the Arkansas Department of Health, we have prioritized the adverse childhood experiences as being something that we need to take a look at. And I don't know if Dr. Meece is here, but this is something that we can work on. We have designations. There you are, Dr. Meece. We have designations within Arkansas. Certain communities have been identified. As you can see, there's only 7 that have no designation. And so there's work to be done. And what this is basically saying is with primary care, dental, and mental providers, there is a shortage. However, because of that shortage, there are resources available to those communities, okay? And we'll get more into that a little bit later in the presentation. And so the National Health Service Peace Corps program is basically a program where we provide loan repayment and scholarships to providers who are working in some of these shortage areas. And so if you know of any primary care doctors, any dentists and dental hygienists, or behavioral health specialists who are going to school or either work in areas that might be within some of those counties, you need to tell them more about this National Health Service Corps program. And so how many of you have heard of eHarmony, by show of hands? Look at y'all all on that website. Hopefully you're not on that website at work. But eHarmony is all about matchmaking, right? And so I heard my colleague, Ms. Joy Gray, she taught me a lot about rural health as well. But the 3R Net program is all about matchmaking. And we match providers to health facilities, right? And so in this website, in this database, you will find over 4,000 jobs that have been posted. So we're looking to find, locate people who want to work in underserved areas. And so we need more traffic to this website. And so in order to get that, we have to pass the word along about the importance of 3R Net in getting physicians, dentists, and mental health providers to work in some of these areas. The J-1 Visa Waiver Program is a program where foreign physicians are able to come over and learn through educational, cultural experience in a visitor format where they come over, they learn, they go to school, and after they finish school, they have to either make a choice to stay here or go back. With the J-1 Visa Waiver Program, they are given the option to stay after they graduate. So by federal law, after you get the J-1 visa, then you have to leave. You've completed your medical education, you have to leave. If you sign up for the J-1 Visa Waiver Program, you can continue to stay. And if you stay here, you have a choice to work in one of the health professional shortage areas. And there's also 10 designated slots where physicians can work in areas that have high need. And so it has to be a place where there is medically underserved and they're serving indigent communities. And so 20 slots are for HPCS only, and then 10 of those are flex slots where, you know, just about any physician can come and take advantage of that. This program is coordinated through the Health Facility Services project. However, in partnership with the Office of Rural Health and Primary Care, we do a lot of referrals because we do the designations. And now to one of my favorite programs. You know I have favorites, Randy. And so this is the Medicare Rural Hospital Flexibility Program, also known as FLEX. The FLEX program basically is all about making sure that our critical access hospitals located throughout the state do not close down, do not shut down. There are 5 core areas of the FLEX program: the quality improvement, financial and operational improvement, and then also the designation of our critical access hospitals. We are moving towards working on population health management as well as innovative healthcare models, but at this time in our grant year, we're not focused on those particular core areas. In addition, through the FLEX program and its resources, we help to coordinate services among critical access hospitals, CEOs, the CEOs, CNOs, and the CFOs get together on a biannual basis and meet, discuss some of the best practices that are going on within their own hospitals, and this information is helpful. Also, the EMS, we work a lot with them, and as well as the health practitioners to help increase efficiencies and quality of care within their hospitals. In order to become a critical access hospital, you have to have at least 25 beds. No more than 25 beds. You have to have an emergency room. And then also you have to be more than 35-mile drive radius away from the nearest hospital. And so there are some stipulations in becoming a critical access hospital. Also, we have the Small Rural Hospital Improvement Program within our office. This program works in tandem with the FLEX program. The FLEX program and the SHIP program are basically doing the same thing. However, the SHIP program focuses more on activities going on within the hospital as far as training and leadership development. You know, when we had the ICD-9 to ICD-10 conversion, we were tasked with helping our hospitals to transition, and so these funds were helpful with doing that particular work. Currently, there are 35 SHIP hospitals, and 6 of them are small rural hospitals, which means we have how many critical access hospitals? Look at y'all. I'm disappointed. 29. Look at y'all. And so right here, what you can see is an Arkansas hospital map done by one of our contractors, AFMC. This map particularly shows you that we have 50 acute care hospitals across the state. 29 of them are critical access hospital, and then again we have our 6 SHIP hospitals, 35 SHIP hospitals, but 6 of them are small rural hospitals. And so as you can see, looking at this map, actually 20 counties within Arkansas do not have access to an acute critical access hospital or a SHIP hospital. And so there's still work to be done. And now on to the SOAR grant. The State Office of Rural Health grant is what I think of as an information clearinghouse. They house a lot of resources, information about policies. Also, they communicate a lot of information about technical assistance that's available to our rural hospitals and our healthcare providers throughout the state. SOAR Assistance provides hospitals and rural health community stakeholders with funding opportunities. How many of you have ever been to one of Kim's grant writing workshops? She does a lot of those. Also, technical assistance with rural health clinics. You know, some of our critical access hospitals also have rural health clinics. And then also she assists through this program as SOAR program coordinator with recruitment and retention of healthcare providers. And so on a monthly basis, Ms. Kimberly Armstrong, who is the SOAR program coordinator, she sends out a monthly grant funding opportunity announcement. This announcement goes out to over 600 rural health stakeholders across Arkansas. And the purpose of this funding opportunity announcement is to let the communities and the stakeholders know that there are resources for you and they are available. The majority of the resources that I've seen in there are for nonprofit, small rural hospitals, and also state government agencies. If you'd like to receive a copy of this funding opportunity announcement, you can email Kimberly Armstrong. That's her email, and also we have a sign-in sheet here to get you on the listserv. Also, with the Office of Rural Health and Primary Care, we send out a weekly reader. This is a listing of all of the announcements, whether it be policies, webinars, grant funding, opportunity announcements, and then here recently when we have news within our own office about different various resources for our critical access hospitals, we let everyone know through our weekly reader. And this is something that Ms. Rebecca Brochus implemented under her direction so that we can streamline our communications within our office. And so if there is anything that you would like to share with rural communities across the state of Arkansas, I know that Kim would be more than happy to share that within our tool here. And also, if you'd like to be on that listserv, actually it's one listserv, but you can email Kim about that. And also, we have the Charitable Health Grants Program. This is a program that's state funded through Act 180 of 2009. And it's basically to strengthen the healthcare system within underserved communities so that they can receive the healthcare services at a reduced rate. And so we have sliding fee scales for the most part, and then no, Daniel's shaking his head. He said no, not sliding fee, free to low cost. There you go. Correct terminology. Free to low cost healthcare services provided to communities, whether it be primary care, dental, and behavioral health services. And so you can see how our programs work in tandem with some of the designations that we do for the primary care office. Thank you, Daniel. As you can see here recently, for this particular funding year, we have over 18 grantees that are funded through our Charitable Health Clinics grant program. They're located throughout the state of Arkansas, and you also see that within Pulaski County, there are underserved pockets there. And we have a couple of grantees that are right here within our own county. And this is not all of the charitable health clinics, but based on the funding that we have available, we are able to award 18. The Office of Rural Health and Primary Care has various programs, as you can see, some of them that have not been highlighted, so that's why I call them the hidden gems of ADH. They're quite resourceful. I just want to just briefly highlight Charitable Health Clinics program, the Primary Care Office, the National Health Service Corps program, J1 Visa, the Medicare Hospital Flex program, also known as Flex, and the SHIP program, Small Rural Hospital Improvement Program, as well as the State Office of Rural Health Grant. At this time, I'd like to acknowledge my colleagues who I work with day in and day out. You might have thought that I was doing all of this work by myself, but guess what? That's not true. We have the And as I mentioned their names, if they could stand within the office, Ms. Tiani Alexander, who is our administrative analyst, if you can stand, please. She keeps our office coordinated, makes sure everybody is on point and ready to go at all times. Mr. Randy Anderson, you might have wondered who has been there the longest. It has been Randy. He's been there the longest. I think he knew Bill Rogers even before he was there. Who is our previous director. He is the PCO coordinator. And then Ms. Kimberly Armstrong. She is the State Office of Rural Health Coordinator. You might see her name when you receive the grant funding opportunity announcement, the weekly reader, and in addition, I did not mention, but the quarterly newsletter as well. She's doing an awesome job with that. And then myself and my newest colleague that I recruited from the 4th floor as the ADAP coordinator, Mr. Harold Clayton in the back. He is serving as our flex coordinator, and Daniel will soon hand over the SHIP program to him, but he just didn't know it yet. And then we have Mr. Taylor Macham. Is he here? Not yet, probably. PCO Recruitment and Retention Specialist. He works alongside Randy to make sure that he's in the community recruiting these nurses, doctors, and dental health professionals. And then last but not least, Mr. Daniel Trotta, who makes sure we submit all of our grants on time and we have money to work on our work plans. And so that's our budget analyst, and he is also serving as the charitable grant coordinator. And in special recognition, I'd also like to briefly recognize my hospital discharge data team. My role is to serve as the coordinator for data to action, and so the hospital discharge team is a great resource if you've not learned about them. But my mentor supervisor, Ms. Tanisha Richardson, if you could stand, Ms. Beverly, Ms. Abir, Amy Line, Betty over there. There you go. I made Betty stand up. I love her, y'all. You gotta love her. She told me don't put her on the spot. But this is my team. Did I miss anyone? Doris. Okay, guess what? Doris works on all of the hospitals. So when we can't contact a hospital and they're not submitting their data, Doris gets on them in the best way. And so she has a quick turnaround with hospital files. Excuse me, so I didn't mean to do that. Charge that to my head, not to my heart, Doris. This is my team. I work in tandem with all of these great folks, and I really enjoy it. To end with a quote, we are all doing our own thing. Now we sit at the table together to collaborate and are able to create systemic change. Now, I've been coming to these grand rounds for quite some time, nearly 13 years, and I know how y'all tackle people. So guess what? I give you a question today, and so we're going to depart in dialogue, not question and answer, and I do have my team just in case y'all try to get me. What does the Office of Rural Health and Primary Care need to know and do in order to eliminate rural health disparities in Arkansas? That's the question. If you have any questions, here's our telephone number for those remotely viewing, 501-280-4529. We'll get you into Ms. Tiani's line, and she can transfer the call to the program coordinator that can best answer your questions. At this time, I'd like to thank each of you for your attention today. Thank you so much.
Great job, LaTonya.
Thank you, Dr. Bala.
You mentioned about the physician retention program in the rural areas. Do you have the other healthcare providers like the nurses, dietitians, who are also sparse in our rural communities? And if you have any incentives or any programs you are aware of that. And second is, we have a great hometown health programs, and does your office work with the hometown health to facilitate some of the disparities?
Yes, great question, Dr. Bala. For the primary care HPCS designations, that includes primary care doctors as well as nurses, correct? You're looking at me like, no. And so the other thing is about the health professional designations, They are listed on the website, all of the core areas and functions and all of the specialties that are included. And so let's make sure that you get that information. The other question is, the Office of Rural Health and Primary Care is actually located within the Center for Local Public Health, and Ms. Andy Ridgway is the oversight for hometown health. And so we do, yes, we work in tandem with the local health units and the local public health facilities. Ms. Andy is going to help me out.
Yes, I was going to just mention that the office is in our branch, our hometown health branch, and has been located there for several years now. And so we do link the Office of Rural Health with communities across the state that are working on hometown health as well. And I just wanted to thank LaTonya for doing this for us and recognize all her work that she's done at the health department for the last several years. And we are definitely going to miss her expertise, and hopefully after she gets her feet wet in another area, she'll come back to us.
I will, yes. Thank you so much, Andy.
Anya, thank you. That was a very nice overview. And I wanted to mention that I loved your title because I have worked with the Office of Rural Health and Primary Care for many years now and consider it to be a jewel and a gem. And the work that's done is really important. And, you know, you mentioned the SHIP program and the FLEX program and the support that we provide for our small critical access hospitals and our small hospitals. I've had the opportunity to attend some of the meetings that your office has hosted for the CEOs and administrators of those hospitals, and it really has provided, I think, a forum for discussion, sharing best practices, developing innovations and collaborations, which I think over the past few years has really been impressive to me. And the National Public Health Service Corps program is a great program, and not enough people know about that program, utilize that program, so every opportunity we should be talking about that, sharing information. And then just the last thing I wanted to mention is earlier this year, Dr. Smith and I, Dr. Zahuri and others from the department participated in a summit that was convened by the Winthrop Rockefeller Institute to bring together leaders from across the state to talk about rural health issues in Arkansas. And the work that the Office of Rural Health and Primary Care has done to assess rural health status was, a key piece of information we used to inform the group. And so just so your folks know in your office, that work is done to inform key decision makers, leaders that are very interested in improving the health status of Arkansans and those out in our rural communities. So thank you all for the work that you do.
Yes, thank you so much, Stephanie.
Toastmaster LaTonya, thank you.
Good, thank you.
Told us that 83% of Arkansas is rural. That's a big number. What we've not talked about, though, is of the 29 critical access hospitals, I wonder how many would survive without backing of health insurance, especially the expanded Medicaid insurance in Arkansas. Is the Office of Rural Health Primary Care able to provide grants to support these hospitals? I'm wondering about the future.
That is a great question, Dr. Mikasa. I think, if Harold were up here, he would definitely tell you that we are doing everything in our power to make sure and ensure that we don't have any hospitals to close. And to my knowledge, over the past 13 years, we've not had any critical access hospital to close. And so that is a great achievement. With that said, we work very hard to provide all of the critical access hospitals, rural health clinics. Kim's doing a lot of that work with resources, grant funding announcements, information about new policies that are coming down federally so that they are alert and ready and geared up to transition. And so it would be my hope that we don't have any, but who's to say? We're doing everything in our power, Dr. Mikasa, to ensure that that doesn't happen.
Thank you. And one other thing I didn't know is that eHarmony is far away from Harmony Clinic Dr. Bala talks about.
Thank you very much. That was a great presentation. I'm relatively new to Arkansas, but the issues that we face certainly are determined by our demographics, and being a very rural state presents problems. And I think one of the questions I have is we have to have some creative solutions to these problems. I don't think we're ever going to get providers out there. I think all the programs certainly are good, but they're not sufficient. So I think we need to start looking at other things, such as community health workers and patient navigators, and empowering the communities to actually participate with our hospitals and with our local health units to provide services. And the remnants of Star Health down in the Delta is something I think we need to. It's another hidden gem that we need to continue to support and see if we can grow and make it something we could scale to other places. So I was wondering, my question is, community health workers and what you all can do to help support community health workers or other innovative programs, whatever you call them.
Yes, great question, Dr. Meece. Recently, actually just last week, the Arkansas Community Health Workers Association held their annual event right here in Little Rock. I was able to serve as one of their speakers at a concurrent session, and I did highlight various rural health programs as well as some of the health statistics branch technical services that are provided to communities. So what I learned from attending that session was that a lot of them don't know about the services that we are providing, and they ask, why didn't they know? And so, all we can do as public health practitioners is to go out and spread the word. And so, with this forum, we are able to share some of the work that we're already doing. But I think that is a great avenue to get out and touch bases with those grandmothers, those aunties who make a lot of the significant decisions within families in the community. So great question, Dr. Meece.
Thank you for telling us so many interesting things. You did it very well. Since we have some time, you've provoked me to say some things about rural health, the hospitals. I'm going to talk about the Affordable Care Act that is under attack, as you know, and is called Obamacare. The Obamacare saved many rural hospitals from financial disaster. And I don't think a single hospital closed since Obamacare was put in place, and several were on the margin, losing money every year in large amounts prior to that. And around the country, in states that didn't embrace Obamacare, many rural hospitals did close. I can just tell you a few anecdotes. I was in one rural hospital a few years ago before Affordable Care, and I asked about the census. I said, how's your census today? And she said, well, it's not very good. And I said, well, what do you mean? Well, she said, well, yesterday we didn't have any patients. Now, to be a hospital, and we, the health department, determined this, you've got to have nurses on staff, a pharmacist, a laboratory, an emergency department that's available and open, a dietetic service. You cannot function like that. I know another hospital a few years ago that had an average census of 2. We have lots of hospitals in Arkansas that have a census of 10 or less. And so how do you make that work financially? Certainly the Affordable Care Act, and these hospitals cannot turn away if they receive federal funds, and they all do. They can't turn away people that need care, urgent care. And so they have no choice. They provide the care the best they can, and money's going out the door lots faster than it's coming in. Now, as you know, the Affordable Care Act is being redone, almost in secret in the Senate. I think about 15 senators are meeting in secret to tell us what we're going to have, without any hearings, without any comments from all the professional organizations that have a have a part to play in all this. I hope you're watching this, and I think every single congressional member of our state has not supported the Affordable Care Act. That's the way it is. So have a heads up.
Thank you for that, Dr. Bates. And that's what our office, does through our weekly reader, our quarterly newsletter. We like to highlight the best practices that are going on throughout the state, and also federal initiatives that public health practitioners need to be aware of. And so make sure, that you get on that listserv so that you receive our communication that goes out each Friday. Thank you so much, Dr. Bates.
Great presentation.
you.
You talked a lot about all the resources that are going out from the federal government into rural areas, and then things that are going out from here in the state capitol to our rural counties. What are some of the local resources that you've seen within communities that kind of help keep people healthy?
That's a great question, Jonathan. I would lean on, my previous work was in the survey section. I was fortunate to be the Behavioral Risk Factor Surveillance System Coordinator, as well as the County Adult Health Survey Coordinator. Those two surveys alone provide a great resource for communities to request and seek grant funding opportunities. And that is the main essence of those two programs. Along with that, we work in tandem with the Hometown Health Coalitions. And as you know, there is a Hometown Health Coalition in each county. And so through their meetings, we were able to come and join them in their work, present the data, and then allow them to strategically plan what they want to prioritize as health issues within their own communities. And so that work through the Health Statistics Branch, along with the Office of Rural Health, we're in the communities and we're assisting through the Hometown Health Improvement Initiative, and we think of them as our boots on the ground.
Okay, thanks.
Thank you.
Thank you very much.
Thank you.